Well, good day, everybody. This is Chris with the Ancient Scholar. I hope this video finds you all doing well. In this particular video, I am going to go over an interesting update. This is more specific to New Mexico, but it has relevance nationwide as well. I do periodically receive updates from our state health alert network system, and this is an update that just came out today. There's a filming of this 25 June 2024, and this is our first case of confirmed acute flaccid myelitis, also known as AFM, in the state of New Mexico. This is the first case since 2018. It was confirmed in a 10-year-old child in Doña Ana County, the Las Cruces or Greater Las Cruces, New Mexico area. So clinicians should strongly consider diagnosis of AFM in patients with acute onset of flaccid limb weakness to ensure prompt hospitalization and referral to specialty care. Case reporting will help CDC monitor AFM, identify introduction of polio into the United States, and better understand factors associated with this illness, because acute flaccid limb paralysis is strongly associated with the polio virus, in addition to other viruses. It goes on to say that AFM is a rare but serious condition associated with sudden onset of acute flaccid limb weakness without another known cause, i.e. trauma, things like that, and lesions in the gray matter of the spinal cord identified on MRI. There can be some white matter involvement. However, gray matter involvement is what defines a case of AFM. We're talking about neuron cell bodies. Most cases occur in children, that's true, and this case occurred in a child. Some of the possible causes include non-polio enteroviruses. Actually, enteroviruses are a more common cause of this post-polio vaccination, such as EVD68 or EVA71. Flaviviruses such as West Nile, herpes, and adenoviruses. Poliovirus should also be considered as a possible cause in unvaccinated patients, which travel to locations with circulating polio. Monitoring the occurrence of AFM is how public health watches for the introduction of polio in the United States, and is a central component of the polio eradication effort. Most patients have experienced a preceding febrile illness 1 to 2 weeks before the onset of flaccid limb weakness. Preceding illness is often respiratory or gastrointestinal, with symptoms of fever, rhinorrhea, cough, vomiting, or diarrhea. Onset of limb weakness is rapid, within hours to a few days, can occur in one or more limbs, and is more proximal than distal. There's loss of muscle tone and reflexes to the impacted limbs. Cranial nerve abnormalities can also be present, to include facial or eyelid droop, difficulty swallowing, speaking, or hoarse, weak cry. Some patients also report stiff neck, headache, or pain in the affected limbs. In severe cases, AFM can progress to respiratory failure, requiring mechanical ventilation, or serious neurological complications such as body temperature changes or blood pressure instability. Just general autonomic instability. AFM can resemble a synovitis, neuritis, limb injury, Guillain-Barré syndrome, transverse myelitis, including spinal stroke, tumor, acute cord compression, or conversion disorder. While AFM cases previously peaked from late summer to early fall in 2014, 2016, 2018, some cases, including this one, have also been reported off-season. In addition, this seasonality was disrupted with the COVID-19 pandemic and has not yet returned to a predictable pattern. As of June 3rd, 2024, CDC has confirmed 7 cases of AFM in the United States, not including the newest reported case from New Mexico, and confirmed 18 cases in 2023. There have been 751 confirmed cases since CDC began tracking AFM in August of 2014. So what are the recommendations? Recommendations in response to a possible increase in cases of AFM, CDC recommends the following. Consider AFM. Clinicians should strongly consider AFM in patients with acute flaccid limb weakness, especially following a respiratory illness or fever, particularly between the months of August and November. Consider polio. should consider polio as a causative agent in these patients, particularly if there is a history of non-vaccination or under-vaccination and somebody has traveled to or come from an area that is more endemic with polio. Hospitalize these patients immediately because this can rapidly progress to respiratory failure. And the signs and symptoms of AFM do overlap with other neurological conditions, as I mentioned above. Therefore, it is critical to consult with specialists in neurology and infectious disease for appropriate diagnosis and management. Laboratory testing, clinicians should collect specimens from patients with possible AFM or polio as early as possible. I won't go into all of that because the actual collection and how to collect can be referenced. And then the importance of case reporting. And it goes on to provide some additional links, but that is basically my high yield interpretation of the document that was released. I thought it is interesting. I don't know that this is going to impact us substantially, but it is certainly something just to be aware of, particularly if you're working in areas where you may be coming into contact with individuals who are under-vaccinated, unvaccinated, and or coming from areas of more endemic polio. And I thought this was particularly relevant for me, the environment where I primarily work clinically outside of my clinical duties with a college. I also, my side job is I work with asylum seekers and refugees that are coming from areas of the world where polio may be more endemic and where vaccination may not occur, or there are high rates of unvaccination and under-vaccination. And so this might present a more pressing concern. And so in that situation, signs and symptoms of acute limb weakness and more acute onset and neurological sequelae that resemble AFM should be taken very seriously. All right, I think that's all I want to say. Short and sweet and to the point. Thank you all so much. Take care. Bye-bye.